Good afternoon, Nancy. It's nice to see you, and it's really neat that we're both here at the Cleveland Clinic, and I'm a past president of the Heart Failure Society of America, and you're the current president of the Heart Failure Society of America. So I'm looking forward to chatting with you. And before we get started, I want to go through a little bit of history that you may or may not know. But one of the first presidents of the Heart Failure Society, second or third, was Arthur Feldman. And Dr. Feldman was very passionate about heart failure awareness and education and spreading the word about heart failure. So I actually have a photograph that I sent to our CEO, John Barnes, last year. And it's a photograph of Arthur Feldman with President Bill Clinton when he signed a proclamation to initiate heart failure awareness. So the Heart Failure Society of America goes way back as far as its interest and its passion in spreading the word about heart failure awareness. So you may or may not have known that, but I'll bet that you will agree that's a pretty neat background, isn't it?
It's a great background, and it's so well needed today, just like it was back in the day in the mid 90s. And so that's really cool that we're able to raise that awareness once a year, and it gets its own week every year in February, which of course we always think of as Heart Month. So that's great.
Well, the other thing I can tell you that's kind of neat too, and I won't tell you how much we spent, but when Mandeep Mehra was president, we had a unique opportunity, and so we decided to jump on it. So 2 or 3 years ago, there was in Times Square in New York City,
I remember this.
on the big board, we bought a blurb for heart failure awareness. And, you know, some of our colleagues thought that that was maybe frivolous spending, but we learned from internet hits and different things that it did get a lot of attention. But it's just it's a big background. So tell me what some of the things are that are happening this year while you're president as far as heart failure awareness.
Well, we're really trying to gear up our 365 program, our 365 community. This is a program Heart Failure Society of America started working on a couple years ago, I think when you were president, when we got our learning management system. And the goal is really to create a multi-pronged year-round community of heart failure providers, patients, and corporations. We want people to be able to network with each other. We want people to be able to get information when they need it. As you know, we've had many new drugs that have come out on the market or that are in research trials recently. And for some people, it may be confusing to sort it all out. And more importantly, it's easy to read the literature and find out about a new drug or a new device, but learning the complexities of how to bring it into your practice and how to use it pragmatically day in and day out can be tough for some groups. And so having a community where we've got wonderful experts within the Heart Failure Society of America community, and having people be able to talk to those experts and get the information they need is really quite amazing. And we're hoping that will come to life a little bit later this year.
Nancy, when I was president, the organization did a little bit of shifting, so to speak. In other words, the Titanic never makes any quick moves, but you were on the board, so you know that we decided as an organization that this organization was started by Jay Cohn, and it really revolved around physicians. Nowadays, we're broadening our scope, if you will, and we're focusing on patients, we're focusing on caregivers. Uh, Tell us how we're expanding awareness to patients and their caregivers.
Yeah, that's a really good point. So, as a nurse professional and not a medical professional, it's important for our community to involve nurses, pharmacists, patients as well. And we really appreciate when patients become members because, really, when we think about our vision is to significantly reduce the burden of heart failure, and it's the patients that we're serving. And so, when we can better understand patient needs and patients' desires and how they can really live a better life, that's really important to all of us. So we really use communities, we use committees to try to bring groups together so that we can really collaborate and really help the organization as a whole, but mainly the members, again, including patients, to really be able to understand what's important to them so that we can help them get the best advantages of joining and belonging to an organization such as HFSA.
And HFSA does have a patient-focused committee
Yes.
within the organization now, correct?
Yes, and in fact, the real focus for the patient organization or the patient committee is to help our patients to become advocates for us, because we know that if a patient has heart failure and they're very passionate about the care they've received and how they're feeling, that they can spread that word to others and help others really understand what they need to do to feel better, live longer, have less morbidity and mortality. And so we really want them to be advocates for us. And that includes all the way up to Washington, D.C., on national, groups and advisory boards, etc.
And HFSA does have a presence with respect to advocacy at a national level. Is that correct?
Yes, we do have an advocate in Washington, D.C. And in fact, we just submitted we used our advocacy to have a discussion among our board of directors about changes to the Affordable Care Act in terms of quality monitoring that involves heart failure. And we gave our opinion to the national government offices that were asking. And so we're hoping that they'll listen to that opinion and work with us to improve quality of patient care over time.
And we both know how much COVID has affected us in many ways. It's certainly affected heart failure patients, and HFSA, I think, has really tried to be at the front as far as helping our patients understand it's okay to get a vaccine, it's okay to take your medicine. But there's one thing that I'd like you to tell our Cleveland Clinic centric perhaps audience about, and that is we were going to have our meeting in Cleveland last year. And unfortunately, with the pandemic, that didn't happen. But can you give us a preview of the future? Are we coming back to Cleveland?
Yes, I'm happy to say that we will be coming back to Cleveland. It's expected that we're going to be having our meeting here, I believe, in 2023. It may be 2023 or 2024. So the expectation is we will be back in Cleveland, and Cleveland, not just Cleveland Clinic, but the whole city of Cleveland and all of our many healthcare centers will be able to shine and show what they're doing with heart failure, and hopefully be able to attend a meeting right here locally and get the best new information at the time.
Well, that's fantastic. And Nancy, maybe I could bring up one last topic. And as you know, that I'm very passionate about implementation and guideline directed medical therapy. And it's unfortunate, and you've published on this, that we just aren't getting the medications effectively into the hands of our patients. And it's sad that we have powerful medications that will save lives, but we're not meeting the measure of getting them out there. update us as to what HFSA has got going in this domain.
So thanks for asking that question, Randy. You know, there's two initiatives, and I'll talk about the one that's in a direct initiative and the one that could be a secondary initiative. The direct initiative is an optimized medical therapy certificate. And what this means is we are planning and developing right now a program that any healthcare provider can get on at any time on their own. So any day, any time, to really better understand the complexities of heart failure, not just medications, but all management strategies. It may also include cardiac devices, so that when people are trying to make the tough decisions because their patients have chronic renal insufficiency or anemia or COPD or atrial fib or all the other complex comorbidities that look alike and sound alike heart failure, that we can do a better job of managing those patients. And importantly, as you mentioned, not only of managing the comorbid conditions with heart failure, but simply getting patients on the right drugs at the right dose at the right time. I think we do a great job nationally in terms of starting medications, but not so well in terms of up-titrating medications. Less than 25% of patients are really on the right drugs at the right doses. In some cases, it may just be documentation that we're just not documenting the contraindications, and so we don't know that the patient's on the right drug at the right dose. But we do know that there's a big problem nationally with that. So this program will allow people to get a certificate saying that they've really been trained and they really understand what optimized medical therapies look like and what they need to be doing day in and day out in their practice. The other avenue that we have going on is a certification program. Now, we know that many heart failure transplant specialists are certified by the American Board of Internal Medicine as a heart failure specialist, but that's not open to all of the centers out there that really don't do advanced heart failure. They don't have ventricular assist devices, they don't do cardiac transplantation. So we want to offer a certification program for heart failure specialty people. It could be a general practitioner who's a specialist in heart failure. It could be a cardiologist. It could be an advanced practice nurse. It could be a PharmD, to really showcase their excellence in heart failure. And hopefully they would wear that certification and carry those initials with pride about the fact that they are excellent in heart failure care. And I think the more people either take the certificate program to increase their own awareness, and the more people that are certified as a heart failure expert, that'll really just help us as a community in total to become better able to manage our patients with heart failure and meet that mission to reduce the burden of heart failure overall.
Yeah. Nancy, that is a fantastic update. And I couldn't close without one other very important area. And so when I was president, I was third successive president, followed by two predecessors, both of three men. And we have worked hard to make HFSA a home for everyone that takes care of heart failure. So I can't express how happy I am that HFSA has evolved and continues to evolve with a very strong focus on diversity, on inclusion. We walk the walk, we talk the talk. We're doing it with our leadership, we're doing it with our membership, we're doing it with our journal. And everyone should understand that this is not a physician's organization. This is an organization for everyone that's involved in heart failure. So I really am thankful that you have taken the reins as I think our first nurse
Yes.
president, and helping our organization continue to evolve.
Well, thanks very much for those kind words. And it's a great honor for me to be the president of HFSA this year. I know I stand on the shoulders of many experts that have had this role beforehand, and you guys have all set a great foundation upon which I'm now serving. So it's been a lot of fun so far, and I hope I'm better able down the road to expand collaboration and education and innovation and research and advocacy, all the things that everybody before me has set the stage for.
Thank you, Nancy. Great to talk to you today.
Yep, have a great one.